Hello to all of you. Let's discuss chapter number 17. And chapter number 17 is about the infectious diseases affecting the nervous system. So let me go into the slideshow mode. So the information in these chapters is very self-explanatory. So for every disease you need to know a few things. So I'm going to go over all those things with you guys. But if you read the PowerPoint, things are quite explanatory. So the first disease we are going to talk about is meningitis. So meningitis can be actually caused by a number of microorganisms, but mostly it's caused by the bacteria. The most severe form of meningitis is caused by bacteria, and the entrance to the central nervous system is facilitated by co-infection or previous infection with the respiratory viruses. So it is usually the entrance of the bacteria and causing this disease is usually facilitated by co-infection with other bacteria or with some previous infection with the respiratory viruses. The diagnosis and the treatment. So basically, the diagnosis is done by lumbar puncture, so which is a spinal tap, or for diagnosis, gram staining is also done, and the culture of cerebrospinal fluid is also culturing of the cerebrospinal fluid is also done when the meningitis is suspected. And treatment is with the broad spectrum antibiotics. And what are the signs and symptoms? So in this disease, there is a severe headache, there is a painful or the stiff neck, fever, nausea, vomiting, photophobia, which is sensitivity to light, skin rashes, and the increased number of the lymphocytes in the cerebrospinal fluid. Okay, so this is in general about the meningitis disease as such. We are going to talk about 5 different organisms which can cause meningitis. The very first one is Neisseria meningitidis. So this is a bacteria. It's a gram-negative diplococci, also known as meningococcus. And this bacteria basically accounts for 15 to 20% of the all meningitis cases. And mostly the cases occur in young children because the vaccination is not recommended until age 11. And there are around 12 different capsular strains of Neisseria meningitis which exist. They include serotypes B, C and Y. Okay, now we're going to talk about pathogenesis and the virulence factors of this bacteria. So this bacteria, it enters the body via the upper respiratory tract. So the bacteria enters through the upper respiratory tract, moves into the blood, rapidly penetrates the meninges and produces symptoms. Okay, so it enters through the respiratory tract, moves to the blood, and through the blood it reaches the meninges. And this bacteria, this pathogen, releases endotoxin into the generalized circulation, which stimulates white blood cells. Damage to the blood cells caused by cytokines leads to vascular collapse, hemorrhage, and petechia on the trunk and appendages. So petechia is basically the eruption of some skin eruptions. It's like some skin eruptions. And this bacteria also produces IgA protease and a capsule. So the signs and symptoms when the meningitis is caused by Neisseria meningitidis: there is a fever higher than 40 or 104, sore throat, chills, delirium, then shock, coma. So these are some of the symptoms of the disease. Prevention and disease. Basically, this disease is treated by using high doses of penicillin G, and it is given intravenously. And the individuals who come in close contact with infected patients should receive preventive therapy with rifampin or tetracycline. Okay, now the next bacteria we are going to talk about is called Streptococcus pneumoniae. So this is another bacteria which also causes meningitis. Now Streptococcus pneumoniae is a small gram-positive flattened coccus. Okay, and it is also referred to as pneumococcus, and it is responsible for causing majority of the bacterial pneumonias. 25% of the patients with pneumococcal meningitis will also have pneumococcal pneumonia. This bacteria, Streptococcal pneumoniae, has a polysaccharide capsule that protects it against phagocytosis, and this bacteria also produces alpha hemolysin and hydrogen peroxide that damage the central nervous system. So these are all important things which are produced by this bacteria. It has a polysaccharide capsule, it produces alpha hemolysin, and it produces hydrogen peroxide that damages the central nervous system. This bacteria is also capable of producing brain cell apoptosis. Apoptosis means programmed cell death, which means this bacteria is also capable of inducing the death of the brain cells. Okay. So when the meningitis is because of Streptococcus pneumoniae, penicillin is not a good choice because the bacteria is often resistant. So in this case, initial treatment with vancomycin and ceftriaxone is used. Ceftriaxone is used. But if the isolate is found to be penicillin sensitive, then the treatment can be switched. And there are two vaccines available for prevention of the disease caused by Streptococcal pneumoniae. That's Prevnar, which is a 13-valent vaccine, and another is Pneumovax, which is Pneumovax 23, which is a 23-valent polysaccharide vaccine, which is recommended for adults. So this one is Prevnar is for childhood immunization, and this is for adults. Okay, now the third bacteria which is responsible for meningitis is called Haemophilus influenzae. Now this bacteria causes severe form of meningitis, and mostly this bacteria also has different kinds of strains. Some strains are with capsule, some are without capsule. So the capsulated strains, they are of different kinds. Out of that, there is there's a strain. The strains are called serotype B. So those strains are responsible for most of the cases in the US. So US cases are mostly caused by serotype B strains. So there are different strains of this bacteria. The serotype B strain is responsible for causing majority of the cases of meningitis in US. And this disease is actually with the serotype B, the incidence rate of meningitis caused by serotype B Haemophilus influenzae is much less now because the vaccine is available. The next bacteria which is responsible for causing meningitis is called Listeria monocytogenes. This is basically a gram-positive bacteria which ranging in morphology from cocobacilli to long filaments. They do not produce capsules or endospores. Okay, so these bacteria, they do not produce capsules or endospores, and they have around 1 to 4 flagella. And this one talks about some of the virulence factors of this bacteria. So this is not a very fastidious bacteria. It is resistant to cold, heat, salt, pH extremes, and bile. This bacteria grows inside host cells and can move directly from an infected host cell to the adjacent healthy cells. Okay, Yeah, here talks about some of the symptoms. So mild or subclinical infection in healthy adults, including non-specific symptoms of fever, diarrhea, and sore throat. So it affects the brain and the meninges and causes septicemia. So what is the prevention and treatment? So the first choice of treatment are ampicillin and trimethoprim, sulfamethoxazole, followed by erythromycin. Okay, so this is the treatment. How this disease can be prevented? Prevention can be improved by adequate pasteurization temperature or by proper washing, refrigeration, and cooking of food suspected of being contaminated. Pregnant women cautioned not to eat soft and unpasteurized cheeses. Okay, now there is a possibility that there is a disease meningitis, and it is not caused by bacteria and or not by fungus. It can be caused by viruses also. So aseptic meningitis, no bacteria or fungus are found in the cerebrospinal fluid. So then the cause of meningitis is majority of the cases occur in children, 90% caused by enteroviruses. Common cause of viral meningitis is initial infection with HS, herpes simplex virus 2, concurrent with the genital infection. The meningitis, when it is caused by viruses, it is generally milder as compared to bacteria and fungal meningitis. It's usually resolved in 2 weeks and mortality rate is less than 1%. Okay, so this was meningitis. Now the next disease we are going to talk about is Zika virus disease. Okay, so you all have heard about Zika virus. So what is the main character of this disease? The main character of this disease is the babies which are born who are infected with Zika virus, they have abnormally small heads, and this condition is called microcephaly. And the causative agent is Zika virus, and this Zika virus belongs to this family called Flaviviridae family. Okay. So the signs and symptoms in adults, they range from none to skin rash, conjunctivitis, muscle and joint pain. It also triggers a syndrome called Guillain-Barré syndrome. Okay, it's pronounced as Guillain-Barré syndrome. So with the Zika virus, this condition can also arise. And this disease can also be in the babies. I mean, they can actually get this virus from their mothers. So they have small head, they have vision problems, involuntary movement, seizures and irritability. So this Zika virus disease is actually transmitted by the bite of the mosquito. It's called the Aedes mosquito, or it can also be transmitted via sexual intercourse with the infected individual, or it can be transmitted vertically in the utero from the mother to the child. So by the bite of the mosquitoes, by sexual intercourse, or by the from the mother to the child. So there is no vaccine currently available for this disease, and the patients who experience this syndrome, they should get extensive physical therapy and may require mechanical ventilation. Okay, the next disease is poliomyelitis. So this is basically acute enteroviral. So polio is a disease which is caused by viruses. So Zika virus disease is also caused by a virus. Polio is also caused by a virus. Meningitis we talked about, it's majority of the meningitis disease is caused by bacteria, but it can also be caused by viruses. Enteroviruses are the ones which cause this disease. The viral meningitis is because of enteroviruses. So polio, it's an acute enteroviral infection. It's an acute enteroviral infection of the spinal cord that can cause neuromuscular paralysis, also known as infantile paralysis. Okay, so signs and symptoms. So they are short term, and it's because of wild viremia. It's because of the virus. So the symptoms are fever, headache, nausea, sore throat, and myalgia, which is the dysfunctioning of the muscles. So if the viremia persists, it means if there's a presence of the virus in the blood, virus is carried to the central nervous system through blood supply, spreads along specific pathways in the spinal cord and brain. Okay, neurotrophic, it infiltrates motor neurons of the anterior horn of the spinal cord. Can also attack spinal ganglia, cranial nerves, and the motor nuclei. So this is the path how the virus spreads to the central nervous system. So it's a paralytic disease. So because there is an invasion of motor neurons, causes flaccid paralysis. Because in this virus can invade the motor neurons and it can cause paralysis. Paralysis of the muscles of the legs, abdomen, back, intercostals, diaphragm, girdle, and bladder can result. Okay, bulbar poliomyelitis, brain, stem, medulla, or cranial nerves are affected. Okay, so this is all part of the your central nervous system. They all can be affected by this virus. Loss of control of cardiorespiratory regulatory centers. Unused muscles begin to atrophy, growth is slowed, and severe deformities of the trunk and limbs develop. Crippled limbs are often very painful. So this is all what happens because of this viral infection. And this poliovirus belongs to the family called Picornaviridae, and the genus is Enterovirus. So they are very small viruses. That's why they belong to this family called Picornaviridae family, because they have a very small size. They are non-enveloped. They do not have the envelope. They are non-segmented RNA virus. So poliovirus is a non-enveloped, non-segmented RNA virus. So naked capsid confers chemical stability and resistant to acid, violent detergents. Okay, now let's talk about pathogenesis and the virulence factors of this virus. So after ingestion, polioviruses adsorb to the receptors of mucosal cells in the oropharynx and the intestine. So we have learned in the chapter on viruses that how do viruses go and bind to the receptors on the host cells. So viruses, they have some proteins on them, on the surface, and through those proteins they can go and bind some receptors on the host cells. So poliovirus adsorbs to the receptors of the mucosal cells in the oropharynx and the intestine. So it's very important to know the route how the infection actually spreads. So they go and adsorb to the mucosal cells in the oropharynx and the intestine. They multiply in the mucosal epithelia and lymphoid tissue, and large number of viruses are shed in the throat, in feces, and some leak into the blood. So on the basis of the number of viruses in the blood and the duration of their stay, the individuals may have no symptoms, or they have mild symptoms, mild non-specific symptoms such as fever, short-term muscle pain, or people can also have a devastating paralysis. What's the treatment? The treatment for this is basically The people who have get this disease, they have like pain in their limbs and all that. They have muscle spasms. So muscle spasm, headache, and associated discomfort can be alleviated by pain relieving drugs. And if there is a respiratory failure, may require artificial ventilation maintenance. Prompt physical therapy to diminish crippling deformities. So to prevent all these things to happen, like somebody to become crippled, physical therapy may help in that situation. And retrain muscles. So basically, prompt physical therapy to diminish crippling deformities and retrain muscles is recommended for acute phase. Is recommended after the acute phase subsides. Okay, how to prevent this disease? Vaccination as early in life as possible, usually in 4 doses starting at 2 months of age. So this vaccines for polio, they are part of the immunization program. Adult candidates for immunizations are travelers and members of the armed forces. There are 2 kinds of vaccines available for polio. One is the inactivated polio virus vaccine, developed by the Jonas Salk in 1954, and the other one is oral polio virus vaccine, which is also called OPV, developed by Sabin in 1960s. So basically, this vaccine contains the attenuated virus. Attenuated virus means a weakened virus. So basically, usually in the vaccines, the strains of the pathogens, which can be bacteria or viruses, which are used are attenuated, which means they are weakened, so that when those viruses or bacteria are introduced into the body, they do not cause the disease, but they can evoke the immune system, so that the person, when actually gets infected by the disease, has the immunity to fight the real disease. So in the vaccines there are attenuated viruses or bacteria. Attenuated means they're weakened. They do not cause the disease, but they evoke the immune system, so that the immune system is ready when the real situation or the real disease happens. Okay, the next disease we are going to talk about is meningoencephalitis, and it is caused by 2 amoebas. So the names of those 2 amoebas are Naegleria fowleri and Acanthamoeba. Okay, let's talk about meningoencephalitis when it is caused by Naegleria fowleri. So it is usually reported in people who have been swimming in warm and natural bodies of the fresh water. So this amoeba is there, and it can enter into the body and it can cause the disease. Okay, so amoeba are forced into the human nasal passages as a result of swimming, diving, or other aquatic activities. It burrows into the nasal mucosa, multiplies, and migrates to the brain and the surrounding structures. So primary amoebic meningoencephalitis is abbreviated as PAM. So this condition, which is caused by this amoeba, causes massive destruction of brain and spinal tissue that results in hemorrhage and coma. Prevention and treatment. So Naegleria meningoencephalitis, it can be treated with amphotericin B, sulfadiazine, or tetracycline in some combination. But usually this disease happens so fast that the treatment is usually useless. But early, we can treat these patients with the if we can treat them early with these antibiotics, then maybe there can be some benefit. Okay, the next is meningoencephalitis caused by acanthamoeba. This disease is called granulomatous amoebic meningoencephalitis. So the disease is quite similar to the disease which is caused by the other amoeba we just talked about. The only difference is the course of infection is lengthy. Okay, the next disease we are going to talk about is rabies. So it's a slow progressive zoonotic disease. Zoonotic diseases are those diseases which are spread by animals. So this disease is characterized by fatal encephalitis, and let's talk about its signs and symptoms. So its incubation period is 1 to 2 months or more. So shorter incubation period in facial, scalp or neck wounds because of the closer proximity to the brain. Prodromal phase begins with fever, nausea, vomiting, headache, fatigue and other non-specific symptoms. Okay, so let's talk about how actually these disease, how does it spreads actually. So infection begins when an infected animal's saliva enters a puncture site. Virus is occasionally inhaled or inoculated through membranes of the eye. Virus remains up to a week at the trauma site where it multiplies. Virus then gradually enters nerve endings and advances towards ganglia, spinal cord and brain. After viral multiplication in the brain, the virus travels to the eye, heart, skin and oral cavity. Cycle is completed when the virus replicates in the salivary gland and is in the Okay. Rabies proceeds through several distinct stages and ends almost inevitably in death unless post-exposure vaccination is performed before symptoms begin. Okay, so what is so special about this virus? Virulence is associated with an envelope glycoprotein. So these viruses, they have envelope and that envelope is made of glycoproteins. So glycoproteins are the proteins which have some sugar chains attached to them. So that is why they are called glycoproteins. So glycoproteins are the proteins with sugars in them, and the envelope in these viruses is made of glycoproteins. So this envelope gives the ability to this virus to spread to the central nervous system and invade certain types of neural cells. Okay, how we can prevent and how it can be treated? Prevention. Bite from the wild or stray animal demands assessment of the animal, meticulous care of the wound and a specific treatment regimen. If somebody has got some kind of a bite from a wild or stray animal, it means we need to be careful with that situation because maybe that animal has rabies virus in the saliva or something. Okay, a combination of so the treatment, the combination of passive and active post-exposure immunization is indicated. So wound is infused with rabies, human rabies immune globulin to impede the spread of the virus, and this globulin is injected intramuscularly to provide immediate systemic protection. Okay, so high risk groups such as veterinarians, animal handlers, laboratory personnel and travelers should receive 3 doses to protect against the exposure. So for this disease there is a full course of vaccination is there. So the high risk people, they receive 3 doses to protect against the exposure. And also the good news is a DNA vaccine for rabies is in development. Okay, the last disease is tetanus. So you must have heard about tetanus. So this is caused by a bacteria called Clostridium tetani, and it is also called lockjaw disease. So it's a neuromuscular disease also known as lockjaw. It's caused by a bacterium called Clostridium tetani. So this bacterium is a resident of cultivated soil and gastrointestinal tract of the animal. It's a gram-positive endospore forming bacteria, and endospores often swell in vegetative cells. So you can see that these are the endospores. This is shown here, Clostridium tetani. These are the endospores and these are the vegetative cells. Okay, so this bacteria produces a toxin called tetanospasmin. Okay, so this is a powerful neurotoxin released by Clostridium tetani, and this toxin binds to target sites on peripheral motor neurons, spinal cord and brain, and in this sympathetic nervous system. Toxin acts by blocking the inhibition of muscle contraction, causing muscles to contract uncontrollably. First symptoms are clenching of the jaw, followed by arcing of the back, flexion of arms, and the extension of legs. So all these things happen in this disease. Now the another condition which happens because of this bacteria is called rhesus sardonicus. So it's basically a condition in which there is a kind of a, it's also called sardonic grin. It's conferred by lockjaw. So basically the muscle in this condition, so this is a condition which is caused by this bacteria, and in this condition the muscles of the person they get contracted, and as a result of that it looks like the person is grinning or the person is smiling. So that is why it's called the sardonic grin, and it's conferred by the lockjaw. And in this case, in this disease, the death is most often occurs due to the paralysis of the respiratory muscles and the respiratory arrest. So this is, as I said, this is caused by a toxin. This bacteria produces a toxin, and it's a neurotoxin. Okay, so mere presence of endospores in a wound is not sufficient to initiate infection. So if in a wound there are spores present, it's not going to cause the disease. It's not sufficient to cause the disease. So bacterium is unable to invade damaged tissues readily. Organism is anaerobic, and the endospores cannot become established unless tissues are necrotic and poorly supplied with blood. Okay, so as vegetative cells grow, so from the spores, okay, from the endospores, when the vegetative cells grow, they release this toxin called tetanospasmin. Tetanospasmin is released into the infection site. So the toxin spreads to nearby motor nerve endings in the injured tissues, binds to them, and travels by axons to the ventral horns of the spinal cord. And the toxin blocks the release of neurotransmitters. Only a small amount of toxin is required to initiate the symptoms. So it's the toxin which is responsible for the disease. So this bacteria produces a neurotoxin. Okay, and this just shows you the condition. And these endospores, they can enter the body through accidental puncture wounds, burns, umbilical stumps, frostbites, and crushed body parts. Okay, now how it can be prevented? So a patient with a clinical appearance suggestive of tetanus should immediately receive antitoxin therapy with human tetanus immune globulin and penicillin G. So penicillin G is antibiotic, okay, and it's a requirement that these people should also get antitoxin therapy, which includes human tetanus immune globulin and penicillin G. So it's a combined therapy. So this, okay, recommended vaccination series. 1 to 3 month old babies consists of 3 injections given 2 months apart, followed by boosters at 1 and 4 years. Protection lasts 10 years. So this is all for tetanus. These are all part of the immunization programs. Pregnant women should also be vaccinated. Toxoid with TIG, which is the tetanus immune globulin, should be given to injured persons who have never been immunized or whose last booster was received more than 10 years previously. Okay, so these people should all be protected so that they don't get this disease. Okay, this is all in this chapter. So basically it's all information. There's nothing much to explain. It's all self-explanatory, but go over them and you have to remember some of the important things.